دكتور بس احنا ثاني ريكورد جاي اوجد واجد دايكري لكلاس روم
مشكلة يعني اعتيادية ريكوردك
والله دكتور اوجد بالمحافظة زحمة الفيديو من دايرة الكلاس روم بقول كي تماشى
بس ارجع هسه كل جروبات يسمعني جروب A جروب B جروب C جروب A جروب B
نعم دكتور نسمع.
قلت أنا ليه عفوا
دكتور انا جروب اي
جروب B جروب B
مش مع دكتور
جروب C
واضح دكتور
ايه تمام هسه we can start today lecture about the impaction. What is impaction? Impaction is one that is the tooth that failed to erupt to dental arch within the usual range of the expected time. The time of eruption of the wisdom tooth, especially lower wisdom tooth, I mean, between 16 to 22 years old. And during this period of the time, the wisdom tooth must be erupted during this time. If not erupted, the tooth means that this is impacted tooth. The term unerupted teeth include impacted teeth and teeth that are in the process of the erupting. أكو فرق بين impacted tooth and unerupted tooth. In unerupted tooth معناته ممكن erupted and in the process of the erupting, but impacted the tooth not erupted. Reach the age of the patient to 60 or 70 or any age, the tooth not erupted. This means that impacted tooth. The causes for impacted tooth due to the adjacent teeth, pressure of the adjacent teeth, or dentine overlining the bone, the bone cover the tooth, dense bone cover the tooth, not lead to erupted the teeth, or excessive soft tissue, covered by the thick soft tissue, or sometimes genetic abnormality prevent the eruption. واضح هسه شنو فرق بين impacted tooth and unerupted tooth, and what are the causes for impacted tooth. Before we do the surgery for impacted tooth, you must take the good medical history. Good medical history, because it's necessary based on information provided you useful information may be found concerning the general health of the patient to be operated. This information, it is important or determine the preoperative preparation of the patient and post-operative care instruction for the patient. Can you give the instruction to the patient according to the medical history? According to the medical history. And clinical examination. The clinical examination is very important for extraction of the lower wisdom teeth, because degree of the difficulty of the access to be tooth is determined in clinical examination, especially when we extracted of impacted third molar, when the patient cannot open his or her mouth because of the trismus, yani limitation of mouth opening. In this condition, you must treat the trismus before you do extraction of impacted third molar. Later that, you do the extraction of the third molar. Also, it is mandatory to take radiograph, يعني X-ray. يعني for lower wisdom tooth, it is mandatory to take the OPG. This is partial, يعني piece or partial of the OPG. It is mandatory to take the OPG or X-ray. X-ray give you the information about the position and type of the impaction and relationship of the impacted tooth to adjacent teeth, and size and shape of the impacted tooth, size and shape of the impacted tooth, and depth of the impacted, and how many the third molar inside the bone, depth, and the density of the bone surrounding the impacted tooth, density of the bone, and relationship of the impacted tooth to various anatomical structure. In the mandible, especially, we have mandibular canal and inferior alveolar nerve. This anatomical structure, it is very important, must be care about it during the extraction of third molar, not to injury to this nerve. Because if this nerve injured during the extraction of the third molar, lead to paresthesia of lower lip in the same side, lower lip in the same side. And also we must care about the mental nerve, mental nerve between, in the mandible, between below the 4 and 5 in this region. In the maxilla, we have just maxillary sinus. Sometimes during the extraction of the third molar or lower schist, the root of the lower schist go to inside the maxillary sinus, and the upper third molar very near to the maxillary sinus. During the trying for extraction, also sometimes go to the maxillary sinus and make the connection between the maxillary sinus and oral cavity. This connection must be treated, But in the lower, must be care about, especially in the to the inferior alveolar canal, ID canal, because inferior alveolar nerve pass through this canal, Indication for extraction. In this area, I mean that the indication for surgical removal of the wisdom tooth, not extraction as a general, and surgical removal, and removal of the impacted tooth or third molar, just especially lower third molar, First, localized or generalized neuralgia of the head. يعني في بعض الأحيان مريض عندها صداع. في هاي حالة نقدر أحد الأسباب الصداع سن العقلي. يعني في هاي حال impacted tooth must be responsible for variety of the symptoms related to the headache and various types of the neuralgia. The second indication for removal of the third molar, pericoronitis. Pericoronitis is acute infection of the soft tissue cover the semi, not fully impacted, semi-impacted tooth and the associated with the follicles. This soft tissue cover the semi-impacted set operculum. In this condition, in the acute infection or acute pericoronitis, must be give antibiotic to subside the infection. After that, we extraction the lower wisdom tooth, or sometimes extraction or opposite tooth, and due to the pressure of the opposite tooth on this soft tissue lead to infection. Other indication, production of the caries. This is caries. This caries due to what? Due to the entrapment of the food particle and bad oral hygiene. Due to the presence of the semi-impacted tooth and may cause caries of the distal of the second molar, distal to the second molar caries, or sometimes the caries occur in the third molar. And food impacted in semi-impacted tooth lead to caries, imma in the distal to the second molar, or the caries occur in the third molar. Food impaction lead to caries. Other indication, decrease bone density or bone supporting the third molar. This is the well-timed extraction of the semi-impacted tooth present in the periodontal pocket ensure the avoidance of the resorption of the distal bone aspect of the second molar, which result in decrease of support. And sometimes the semi-impacted tooth lead to resorption of the bone support to the second molar. Resorption of the bone in the distal area of the second molar. Other indication, when you do the denture, partial denture or complete denture, and place it in the patient mouth, the denture not became fit to the ridge due to the presence of the impacted tooth. In this condition, you must extraction of wisdom tooth before the placement of the denture or partial denture. If you put the denture, lead to pain and edema. Other indication, obstruction of normal eruption of the permanent teeth. This is impacted third molar lead to prevent of eruption of the second molar. This is second molar, not erupted in the dental arch due to the impaction of the third molar. And in this radiograph, this is central incisor. This is not erupted to the dental arch due to the canine, impacted canine. This is impacted canine lead to prevent eruption of the central incisor, this tooth, in the dental arch. Other indication, provoking or aggravating orthodontic problems. Sometimes lack of the room in the dental arch is possibly the most common condition for extraction. Primarily of the impacted and semi-impacted third molar of the maxilla and mandible. Sometimes the crowding of the tooth or no space for making the good orthodontic treatment. In this condition, you must extraction of the third molar in the upper or lower. Participation in development of various pathological conditions. This is impacted tooth. This is pathological condition like cyst, or sometimes if very large, this is impacted tooth is very large. You sometimes when you take the biopsy, the result of the biopsy tumor. This is large radiolucent area in pathological condition due to the impacted tooth. An impacted tooth must be extracted with the lesion. In this condition, not just extraction of the third molar, with the lesion must be. Other indication, destruction of adjacent teeth due to the resorption of the roots. This is lower 7 impacted, lead to resorption of the root of the lower 6. And this condition, this is impacted of the third molar, lead to resorption of the root of the lower second molar. And this is upper impacted tooth, lead to resorption of the root of the upper second molar. Yani sometimes impacted tooth lead to resorption of the root of the adjacent teeth. Step of the surgical procedure. We have principle for extraction of the third molar. First, incision and reflection of the mucoperiosteal flap. Incision and reflection of the mucoperiosteal flap. Second, removal of the bone to expose the impacted tooth. Impacted tooth sometimes it is covered by the bone or by the soft tissue. If just covered by the soft tissue, no need sometimes for removal of the bone. But if covered by the bone, must be the bone removed. After that, remove the impacted tooth. And luxation of the tooth. 4. Care of the post-surgical socket and suturing the wound. Because sometimes you remove the third molar and you make the space. This space must be sutured. If not sutured, the food impacted in this area and lead to infection. Infection of the socket mean dry socket. Dry socket is painful infection of the socket. The management of the dry socket, irrigation by the normal saline and put the alvogel. The main factors for successful outcome to surgical procedure as the following. First, correct flap design. Correct flap design, which must be based on the flap. How can you make the correct flap? Properly make the good design for the flap. This is based on the clinical and radiological examination for position of the patient, position of the tooth, and relation of the root to anatomical structure and root morphology. Why root morphology? Because if the root fused, easy for extraction, and the root bifurcated, not fused, need for sectioning of the root, and root one piece removed, and after that the other piece of the root. Root removed in two parts, and major root and distal root. Root removal by the two situation. Second, ensuring pathway for removal of the impacted tooth. Must be a space for removal of the tooth. With little bone removal as much as possible, because if you removal more bone during the surgical procedure. After the operation, patient complained from severe pain and large hematoma, and large swelling. And as much as possible, you remove less bone during the surgical procedure. This achieved when the tooth is sectioning, and the sectioning the tooth, and removal in the segment and part or piece, which cause less trauma possible. And how can you make the tooth removal and patient feel little pain or swelling by sectioning the tooth and segmented the teeth. indication خلصنا الانديكيشن. هسه نجي على الكلاسيفيكيشن. اكو سؤال بالانديكيشن؟ Classification of the impacted tooth third molar according to the Archer and Kruger. We have two types of the classification, يعني Archer and Kruger and Pell and Grigori classification. Archer classification is very easy according to the angulation. The first one, megio-angular. This is megio-angular. The third molar tilt to second molar, tilted or inclined to the second molar. Disto-angular, the third molar tilted to the ramus, inside the ramus. This is disto-angular. And vertical, this is vertical impaction, like this, vertical. Other type, horizontal, like this. This is horizontal. We have other type, bucco-angulation, يعني crown faced to buccally, bucco-angulation. This is face of the crown of the third molar, bucco-angulation. And this one, lingo-angulation, the crown faced to lingual side. Lingo-angulation. And this one, inverted, يعني عكس. This is difficult for removal. And which one is difficult, يعني according to the angulation? The disto-angular. Disto-angular is difficult, the difficult one for removal, because this is inside the ramus, need more bone removal, inside the ramus. And in all kind or type of the impacted, you must be care about this anatomical structure. This is ID canal, inferior alveolar canal. This pass through this canal, inferior alveolar nerve. We have other classification, Pell and Grigori classification. This classification classified the impacted third molar according to criteria. First, depth of the impacted and proximity to the second molar. Depth of the impacted and proximity to the second molar. The first one, A. And B, position according to the distance between the second molar and anterior border of the ramus. يعني second molar and anterior border of the ramus. We have two types of the classification. Third one according to the depth, and the second according to the distance between the second molar and anterior border of the ramus. Now I explain for you in details. Pell and Trigori classification, class 1 impacted. The mandibular third molar has sufficient anteroposterior room to erupt it. يعني this area sufficient to erupt the third molar. The anterior, يعني the distance from this area to area. And the class 2, يعني approximately half is covered by the anterior portion of the ramus of the mandible. يعني نصف of the half of the impacted covered inside the ramus. And class 3 completely impacted tooth inside the ramus. Completely embedded in the bone of the ramus of the mandible. This classification, I repeated. Class 1, the area between the anterior border of the ramus and this area is sufficient to erupt the third molar. And in the class 2, half of the impacted tooth, and crown of the impacted inside the ramus. And in the class 3, impacted tooth completely inside the bone. Completely inside the bone. And we have other classification according to the occlusal relation to the occlusal plane. Class A, B, and C. In the previous 1, 2, 3, in this in relation to the occlusal plane, we have A, B, and C. The occlusal plane of the third molar is in the same of the occlusal plane of the second molar. Occlusal plane of the second molar, occlusal plane of the third molar are the same level of the occlusal plane of the third molar. And in B, class B, occlusal plane of the third molar below the occlusal plane of the second molar and above the cervical line. But in the class C, occlusal plane below the cervical line. Class A, occlusal plane of the impacted tooth are the same level as the occlusal plane of the second molar. Class B, occlusal plane of the impacted tooth between the occlusal plane and cervical line of the second molar. Class 3, impacted tooth is below the cervical line of the second molar. Class A, occlusal plane third molar are the same level of the second molar. In class B, this is occlusal plane of the third molar between occlusal plane second molar and cervical line. In class 3, in class C, occlusal plane below the occlusal plane of the third molar below the cervical line. We have some factor that make the impacted tooth surgery less difficult and easy for extraction. If you see this factor present, mesoangular position, يعني the impaction mesoangular, not inside the ramus, distoangular. Type of the classification, any class 1 or A. Class 1, what is class 1? Class 1 means that the space between the anterior border of the ramus and distal to the 7 enough for crown of the third molar. And in Pell and Gregory class A depth, what mean that? Mean that the occlusal plane of the third molar are the same level of the occlusal plane of the second molar. Root 1/3, 2/3 formed, 1 to 2/3, يعني تقريبا more than 2/3 of the root formation. 5 fused conical root, because easy for extraction. If the root not fused or not conical, difficult for extraction, need to separation. Wide periodontal ligaments, large follicle, elastic bone, not dense bone, separated from the second molar, not attached to the second molar, separated from the inferior alveolar nerve, away from the inferior alveolar nerve, to prevent damage to this anatomical structure. Soft tissue impaction, not bone impacted. And we have some factors, and opposite to the previous, make the impaction or make the surgery more difficult. Distoangular. Why distoangular? Because the impaction inside the ramus. Pell and Gregory classification 2 and 3, or B and C. 2 and 3, what is 2 and 3? 2 means that partial or piece of the root, piece of the crown inside the ramus. And what is 3? Completely inside the bone. Yani third molar completely inside the bone. And B, what mean B? B means that the occlusal plane of the impacted third molar between the occlusal plane of the third molar and cervical line. And C, what means C? Occlusal plane of the third molar below the cervical line. Long and thin root, divergent curved root, not fused, narrow periodontal ligament, thin follicle, this care about it, dense inelastic bone, because if the bone dense, more dense, when you try to extraction of the third, the tooth fracture it, because bone is very dense. Contact with the second molar. In this condition, you make the injury to the second molar and close to the inferior alveolar canal, or complete bony impacted. Need more bone removal. And approaches for removal of the impacted third molar. Type of the flap, yani how can you remove the impacted third molar? You must first make the flap. We have two types of the flap. The first, triangular flap, like this, مثل زاوية, triangular flap. The incision for this type of the flap began at the anterior border of the ramus. Where the anterior border, يعني external oblique ridge, anterior border of the ramus. Internal و external. This is internal border, this is external border. External, يعني start from the external border of the ramus. With special care for lingual nerve inside the lingual, يعني in lingual side, and extend as far as distal to the 7, distal to the second molar. يعني the incision starts from the external oblique ridge and downward, يعني distal to the 7. And in lingual side, you must care about the lingual nerve, because if the lingual nerve injury lead to loss of sensation in the lingual side of the mouth and anterior two-thirds of the tongue. Loss of the sensation in anterior two-thirds of the tongue in the same side, and the mucosa in the lingual side in the same side. Sometimes we have variation for triangular flap. Triangular reach to the distal to the first molar. This is variation of the flap incision, and from the external oblique ridge to distal to the first molar. Variation and vertical releasing is distal to the first molar. The medial extension of the is necessary due to the position of the third molar compared to the second molar. Other type of the flap or envelope or horizontal flap, like this envelope or horizontal flap. The incision began at the anterior border of the ramus and extend to distal aspect of the second molar and continue to cervical line to the last two tooth, يعني second and first molar, ending at the first molar. This type of the flap is usually used when the case's impaction is relatively superficial. Extraction of the impacted third molar in horizontal position. This is in horizontal position. First, you make the horizontal incision from the anterior border of the ramus reach to the medial side of the first molar. After that, reflection of the flap by periosteal elevator and expose the tooth. After that, what we do by surgical handpiece. Because surgical handpiece not push the air, yani without air, just water or normal saline. By surgical handpiece, remove the bone, cover the impacted tooth, and remove the bone, cover the crown of the impacted tooth. After that, by the surgical handpiece, we cut the crown of the impacted tooth, but must be care about the ID canal to prevent injury to the inferior alveolar nerve, like this.